Spectrum TV, broadening your horizon.
The hustle is real, but with hard work, you can become successful. And be your own king. Your wins are worth celebrating with Chelsea London Dry Gin. Chelsea London Dry Gin now comes in a non-refillable bottle with guala cap. Chelsea London Dry Gin. Right spirit, right feeling.
Do you know that the deadliest hepatitis, which is hepatitis B virus, HBV, has contributed to an estimate of 820,000 deaths every year in the world and affects approximately 296 million people, including over 6 million children under the age of 5. In Nigeria, the highest hepatitis B virus prevalence in rural settings is 10.7%. The Northwest region has the highest prevalence of 12.1% among Nigeria's 6 geopolitical zones and regions. Also, 25% of chronic hepatitis B infection progress to liver cancer, according to subgroup analysis. Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be fatal. It is a viral infection that lives inside a living cell in the human body.
How often do you check your health status? How often do you check your hepatitis status? Hepatitis is the inflammation of the liver. What could be the causes and how can it be prevented? Let's find out.
Dr. Agantem Ekuma, a medical microbiologist, University of Uyo Teaching Hospital, UUTH, disclosed that hepatitis virus comes in 5 main strains, which includes types A, B, C, D, and E. While they all cause liver disease, they differ in important ways, including mode of transmissions, severity of the illness, geographical distribution, and prevention methods.
Yes, hepatitis is an infection of the liver. And most of the common causes are caused by viruses. So basically, hepatitis is infection of the liver and the symptoms that are associated with it. The viruses are the common causes, so the types of hepatitis are named according to the viruses. So we have hepatitis A, hepatitis B, hepatitis C, D, and E. I think those are the common ones that cause hepatitis virus. So HIV is a virus also, and hepatitis also is a virus. So hepatitis, the ones I've mentioned, are viruses. So unlike HIV that attacks the cells of your immune system, hepatitis attacks mainly the cells of your liver. So it causes liver damage and eventually liver failure. Yes, because they cause chronic infection, prolonged infection.
The virus may be caused by viral infection, alcohol consumption, several health conditions, or even some medications, and can be transmitted through body fluids such as blood, vaginal secretions, or semen.
Like I said, they are viruses. So the viruses are infectious particles, and so they can be transmitted from one person to the other. So like I said earlier, hepatitis A and E are mainly transmitted by food, but they cause mild disease, so we don't consider them as a very serious problem. But the ones that are of much public health concern are hepatitis B and C, and those ones are transmitted by body fluids. So it can be transmitted by sexual transmission. It can be transmitted by blood transfusion if the blood is not properly screened. It can also be transmitted, through unsafe injection, sharing needles and things like that.
The 5 main viral classifications of hepatitis are hepatitis A, B, C, D, and E, and a different virus is responsible for each type of viral hepatitis.
The common ones and the ones that cause chronic infections are hepatitis B and C. So hepatitis D can occur together with hepatitis B, but it's not so common around here. Hepatitis E too, it's not very common, but it's a milder form, just like hepatitis A. So those ones are associated with food. They are transmitted by food, and then they tend to have a shorter duration compared to B and C, which can last a long time and cause severe liver diseases. Yes, so hepatitis A causes acute hepatitis, which is usually self-limiting. So it presents with body pains, feeling of illness, and then they may or may not be yellowness of the eye, abdominal pain, dark colored urine and all that. So, but usually with or without treatment, the body tends to contain the virus, and most cases, more than 99%, will resolve without progressing. But there is a little percentage that may have a fulminant infection. That is, the infection just goes beyond control and can lead to death, but it's extremely rare. So for most cases of hepatitis A, usually it occurs in outbreaks among children, so someone infected, passing it in his stool, does not follow proper hygiene, can spread it to other members of the household or other persons he interacts with. So that is hepatitis A. It usually occurs in outbreaks, but we are not seeing that as a major condition or cause of mortality in this environment.
Hepatitis B virus is the most common form of parenterally transmitted viral hepatitis and an important cause of acute and chronic infection of the liver. The incubation period of hepatitis B is variable with a range of 1 to 6 months. Acute hepatitis B is frequently enecteric and asymptomatic, although a severe illness with jaundice can occur, and occasionally acute liver failure may develop.
Okay, so I've already mentioned that they are caused by viruses and they are transmitted by sexual intercourse, blood transfusion, and the sharing of needles, anything that involves body fluid. So if contaminated body fluid comes in contact with your own body fluid, which can happen in any of these settings that I've just mentioned: sexual intercourse, transfusion, sharing of needles, and other things that will expose your blood to other things. So when this occurs, the virus affects your liver, and the symptoms that I guess you're asking about the symptoms. So the common symptom that we say of hepatitis is yellowness of the eyes, and sometimes abdominal pain, sometimes fever, and all that. But for hepatitis B and C, sometimes those symptoms may not appear at the initial stage, and it should just progress and become a chronic infection. So those symptoms may or may not be present, but in the long term, after the virus has stayed in one's body, particularly hepatitis B, if it has stayed in one's body for several years, it now causes chronic liver damage. It will be damaging the liver gradually and progressively until it gets to a point where the liver is unable to function, and that leads to other symptoms which eventually can lead to death if not properly treated.
Treatment and prevention of hepatitis virus varies based on the type and underlying cause.
Hepatitis C is more easily curable. There are now very highly effective drugs available, although they are quite costly. So with early treatment, early diagnosis and treatment, a full cure can be achieved. There are also treatments for hepatitis B, but not so effective as the ones for hepatitis C. There are antiviral drugs. Yes, and they can be prescribed by a qualified physician. Well, I think all efforts should be geared towards prevention. So if you're living a safe lifestyle, you are you are carrying out safe sexual practices, you are only getting blood transfusion from, reputable health institutions where you are sure that the blood is properly screened, then I would say the risk of acquiring this hepatitis B and C is very low. And so one may not really need to go for testing on such a regular basis. For hepatitis B, there is a vaccine that is effective. So if you've not been vaccinated, you need to get vaccinated. If you're not sure of your status, you can be tested to know whether you have antibodies against that infection, because that's what the vaccine does is that it makes your body to develop antibodies, so that if you come in contact with the virus, it will not be able to, and the infection will not be established. But that's for hepatitis B. So for hepatitis C, we don't have such a vaccine. There's no vaccine available yet. So prevention still remains key for control of hepatitis C. So that's for vaccination. Then for safe sex, of course, limit your sexual partners. And if you cannot do that, then barrier method, use of condom and all that can provide some degree of protection from that route. Then again, blood transfusion. Make sure that any blood that is being transfused is gotten from a reliable source. Then avoid sharing of needles. So all needles for injection of whatever should be single use, should not be shared under any circumstances. So if you do this, I believe that you are protected and covered from these infections. Your initial vaccination, 3 doses, taken over the course of 3 months. So after that, it's recommended that every 10 years one should get a booster. But we see people even beyond 10 years still having high levels of antibodies. So it depends. I strongly believe that the vaccine gives protection for more than 10-20 years.
To prevent hepatitis, Dr. Ekuma has advised regular medical checkup, avoid multiple sexual partners, get vaccinated. Remember, hepatitis can lead to chronic diseases and death. My name is Esther Otoyo. Enjoy the rest of our program on Spectrum TV.
Spectrum TV, broadening your horizon.
While we all experience mood changes in response to life's events, some people's mood fluctuate much more than usual. When this shift in mood causes changes in the behavioral pattern of an individual, some results to depressive disorder, popularly known as depression. Join us as we drive into the unpleasant streets of depression.
I grew up in a wonderful and beautiful family. I used to do very well in school, but when I got into medical school and I failed one of my major examinations, I allowed sadness, worries and anxiety take over me.
Actually, I'm a medical student, so that happened, weeks ago, and about our pediatrics posting exam, so it was quite very bad. We had a massive failure, and I didn't expect to fail the test. So I found myself being depressed. I think it was more than a week. So I had to put myself together and come out from it.
Depression, as a major public health problem, has the prevalence of 4.4% in the global population and 5.4% in the African region. It also affects about 322 million people globally. The World Health Organization (WHO) figures shows that depression in Africa is common among females with 5.9% compared to males, 4.9%. Meanwhile, in Nigeria, the prevalence of depression is estimated at 3.1%. Depression is a common and serious medical illness that negatively affects how a person feels, thinks, and acts. It is a mood disorder that causes a persistent feeling of sadness and loss of interest. Depression can also be called clinical depression when diagnosed. It can consequently lead to a variety of emotional and physical problems. Spectrum Television, in our quest to know the causes and preventive measures of depression, visited Dr. Nkanga, a mental expert in the University of Uyo Teaching Hospital, UUTH, to get the statistics of depression incidents in Akwa Ibom State.
Depression is a mood disorder. It's a disorder that affects a person's ability to experience their environment, themselves. It is characterized by persistently low mood occurring on most days for at least 2 weeks. So it doesn't have to occur every day for we to say, okay, this person is depressed. It could occur as frequently as 4 out of 7 days. Persistent low mood. And it has other features apart from the low mood. Local statistics for Akwa Ibom, we can't say for sure what the statistics are for Akwa Ibom, but globally, there's 2 times more women coming down with depression than men. But a lot of times, we are curious about this value because depression presents a little bit differently in men than in women. Women are expected to be more emotional and so express themselves when they feel sad. Men are expected to be more reserved and not so expressive. So usually when we think of depression in men, it doesn't fit the typical persistently low energy levels, persistently low mood, low appetite. Some men might just present as being very angry and hopeless and having poor interpersonal relationships, and the next thing we might have a very bad consequence such as suicide from the depression in men. So local studies, for now we don't have that data, but the global studies that show 2 females to 1 male is replicated all over the world, both in Nigeria, both in the US, whatever country you are in. It's 2 males to 1 female.
Different factors contribute to the development of depression, including genetics, medical condition, medication, and the economy of a state or nation, among others.
There's not one singular cause for depression. We like to refer to the many causes as risk factors. When we say risk factors, we mean if this thing is present, there's a likelihood that this condition can present. So for depression, if there's a family history of depression, mom, dad, aunt, uncle, brother, sister, there's an increased likelihood of this person having depression. Female gender, the women are more at risk for depression than men. People blame the hormones that women have as responsible for this. Apart from that, it's not just women. A particular class of women are especially at risk for coming down with depression. Women who have 3 children who are less than 15, who do not have any social support, and who do not have a job outside their home. That's a recipe for disaster for their minds and their emotional state. So those are risk factors for depression. Living with a chronic medical condition is also a risk factor for depression. Living under harsh socioeconomic circumstances is also a risk factor for depression. Early childhood adversity is a risk factor for depression. Any other psychiatric illness is also a risk factor for depression, such as anxiety disorders, people who use substances. These are also risk factors for depression. So you could have one person who has all of these factors and could explain why they come down with depression. And you could have one person who has depression but didn't meet any of these risk factors. So they are not causes, they are risk factors. If people are not able to meet their basic needs like feeding, people are not able to afford education for their children, if people are so poor that they can't even afford basic health care, those who live with chronic diseases, their diseases will worsen and their chances of having depression increases. So the socio-economic state of a country has a role to play in the mental health of its populace. If people don't have hike in food provisions, transportation, people who are even struggling to have ends meet, a lot of people are going to be laid off. That is a loss event. Losing a job is a loss event. It can trigger depression. So yes, the economy is very important in whether or not an individual comes down. So it's poor economy like we're having now adversely affects the mental health of its populace, and most people will come down with depression who are predisposed, because the prevalence of depression generally global is about 33% of people. That's Nigeria statistic. 33% of Nigerians live with depression. So that's very high. So if you count 10 people, 3 people are depressed.
The symptoms also vary slightly depending on the types and can range from mild to severe.
There are different kinds of depression. There's the major depressive disorder. That is just depression existing on its own, and it has to meet the criteria for depression. Where there's persistent low mood on most days of the week for at least 2 weeks. There's persistently low energy levels. There's loss of interest in previously pleasurable activities, poor concentration, and all the other symptoms. They need about 5 symptoms to be present. So that's major depression. There's also what we call bipolar depression. This is an individual who lives with depression and lives with a condition we call mania or hypomania. So it's an entity that has depression and then another psychiatric presentation. And it's a little bit, it presents similarly to depression, with depression when they are presenting the depressive phase. But when they leave the depressive phase, it's quite a different picture. And there's also a kind of depression we call dysthymia. It's sub-threshold depression. So someone can live with persistently low mood, low energy levels for as long as 2 years, but they're able to go to work. They're able to interact with their family members, but you'll find that this person might be referred to as an introvert that likes to stay by themselves. But what will be different about this person is that that person has not always been an introvert. You know, there are people who have always been introverted right from their childhood. Their mother will tell you, oh, he's a shy, quiet person, and all of that. But people who are not described as such, suddenly over the course of their adult life, perhaps after a life event, like a loss event, which I failed to mention as one of the risk factors earlier, you notice this person is not more withdrawn, having difficulty maintaining social interactions for a long time. So this is this time, and the person can go to work, the person is gisting with you, the person will even follow you, go to the market, they're running their household, they're running their lives well, but there's this low energy, so it's like a sub-threshold kind of depression. These ones are quite dangerous in the sense that there's an increased likelihood of them coming down with the full-blown major depressive disorder, and if they do, the prognosis is usually poorer. So apart from that, there's also depression that could arise from other organic conditions. When we say organic, we mean conditions that are affecting other parts of our bodies besides the behavioral component of our brains. So people could have depression from endocrine diseases like thyroid diseases. People who live with diabetes are more prone to depression. Remember, the risk factors are a chronic illness, and diabetes is a chronic illness. So that could also cause depression as well. Even chronic inflammatory conditions.
The death of a loved one, loss of job, or the ending of a relationship, popularly called breakfast, are difficult experiences for a person to endure. Some mistake these feelings of sadness or grief, which develop in response to such situations, for depression.
Now, depression has its criteria. Like we've said before, 2 weeks of persistently low. That characteristic of persistently low also has another quality to it. It is pervasive. It means no matter the circumstance, even if what is the biggest amount of money that can enter and shake somebody's accounts enters, the person does not feel any improvement in their mood. And when somebody is sad, there isn't a loss of interest in previously pleasurable things. If you give them something that they consider pleasurable, you could improve their sadness. But in depression, the sadness does not improve. It has a sinking, deep quality to it. It is pervasive. It affects all parts of their function. So it's different from sadness, where someone could wake up on the wrong side of the bed one day, and then suddenly they get an alert, and then they feel fine. So there are two different qualities. Even the person describing it to you is completely different. Now, grieving after a loss event, there's usually that loss event present. And we expect that the person goes through the stages of grief. This person would also, after maybe the initial shock and denial and then acceptance, bargaining, acceptance and all of that, the person would usually come to terms. There's usually not a progressive worsening of that person's function as you would see in depression. When someone gets depressed, even if it's after a loss event, because grief can lead to depression. But the difference with grief and depression is that with grief, the person improves with time. But in depression, the person tends to worsen with time. So they could look similar at first when it starts. But over time, you see that this person has gotten over the loss, or this person is even getting worse. They can't function, they can't go to work because of how tired and weak and sad they are.
One of the risk factors of depression is suicidal feelings. Depression itself, if not properly managed, can lead to death. In recent days, there have been reports of suicide in different regions of the world and in the country. Dr. Nkanga explains the risk factors.
Depression, although it arises from changes in the brain chemicals, our brain chemicals are also responsible for our style of thinking. So if you notice when you are in a good mood, everything looks hopeful. But depression, the brain of someone who is experiencing depression, the chemicals responsible for allowing you to feel happiness are either not enough or not there at all. So by the time that person's frame of mind is persistently low, negative thoughts begin to arise. And so the person has what we call cognitive distortions, where the person begins to feel like they are worthless. The person begins to feel like they are hopeless. Tomorrow, in fact, there's no tomorrow. I might as well just end it all now. And the person might also begin to feel like they are helpless because of the effects of the chemicals on their brains. It doesn't allow them experience happy chemicals, in quotes, serotonin. So they can't experience joy. And so their thinking style changes and they feel worthless, helpless, hopeless. And usually what follows by the time you have that triad is suicidal ideation. And sadly, it ends in completed suicide.
But is suicide really an option when depressed?
Suicide is not an option. I think depression is caused by load. If you carry so much load, you have to make an adjustment in life so that, because if you want to travel far, you have to travel light. Leave some certain things behind and move ahead concerning the aim and objective that you have in life.
Committing suicide means that ends your life and the story. But I think in that very situation of yours, you press on. You take this strategy wasn't working, you take another strategy. It might finally work. Committing suicide is losing hope. Like that is the end. You don't press on to try for another steps.
When you commit suicide, the problem you have at hand, you end up not be able to, you cannot solve that problem again. You've ended your life miserably. So for me, I don't think that suicide is the best option.
They're not supposed to do that because God did not tell anybody to kill himself. You live, if you commit any offense, no matter how a big or a small, put it for government hand or God hand. Some people kill themselves because maybe sometimes that thing will be exposure or maybe refill for bad thing that they do. They don't want other people to know the secret thing behind their back. They kill themselves so that thing will be flushed. But it's not good. Give it to government or God.
Treatment of depression varies depending on the severity, and the victim can respond quickly to the treatment when identified early.
Well, once it's identified, we meet a mental health professional, clinical psychologist or psychiatrist. An assessment is made for this person. Even meeting a GP to help you make the final diagnosis and properly refer the person if need be is the first step. The person might need psychotherapy or medication, depending on the severity of the depression. Also, for depression, as much as possible, prevention of depression starts even before someone becomes an adult, right from when the child is in utero. Providing proper antenatal care, nutrition for children, a balanced diet, proteins, minerals to aid brain development. Because adverse childhood events include malnutrition, include loss of a parent. So the security and safety of the country comes to play now. If terrorism snatches a parent from their child, that child has experienced an adverse life event, and the risk of that child coming down with depression is high. If parents cannot buy basic nutritious food for their children, it puts those children at risk of depression, not just only as adults, but even as children. And if a child comes down with depression, their ability to even cope and meet milestones with their peers gets slimmer and slimmer. So it's like a self-supporting cycle of being trapped in the mire of depression. Its effects are, it's a cascade that affects generations. If people know what depression looks like, then they might be able to do something about it. Two is the quality of life of the populace should be improved, at least to the barest minimum. Provision of basic healthcare needs. Accessing healthcare globally is expensive, and even more so in a deprived country like Nigeria. Basic healthcare, accessible, affordable. A basic wage that can support an average Nigerian should be able to have a balanced diet. Things as simple as a child having an egg a day can reduce their chance of coming down with depression. If we have basic health facilities, mothers can attend antenatal care, and then adverse outcomes during pregnancy can be reduced. So the child's brain is already protected in utero. The child comes out, is well fed. The mother doesn't have to work 3 or 4 jobs in order to make ends meet, so she can focus on her attention on the upbringing and the emotional support that child needs, because she doesn't have to worry about several sources of income which are meager and can't support her. And then provision of healthcare professionals. Nigeria is lacking in healthcare professionals, even more so mental healthcare professionals. So people are unemployed. Provision of basic employment. That is a very, very major risk factor, because it's one strong socioeconomic cause or risk factor for depression, unemployment. So yes. And then for the populace, keep an eye out for your neighbor and for yourself, and talk to someone about how you feel. One quality of depression is that it makes the person who is depressed feel like if they are going to tell you how they are feeling, they are going to be a burden to you. And that's the quality of depression. So don't even go out of their way to tell you how they are feeling. They tend to keep it and suffer in silence. But please, if you feel a certain way, you can't cope with a lot of things, life is suddenly becoming overwhelming, a trusted person, reach out. And also, when we find people are suddenly more withdrawn, keeping away, we should reach out. They might not be forming, they might be suffering.
Despite the availability of evidence-based treatment, some patients usually do not get the amount of help they need to manage depression. From our interactions, first step towards tackling depression is raising awareness. Remember, depression can lead to different mental disorders. So, medical experts have advised that you talk to loved ones, family, friends, among others, whenever you feel depressed. My name is Esther Otoyo. Keep enjoying our programs on Spectrum TV.
The hustle is real, but with hard work, you can become successful. And be your own king. Your wins are worth celebrating with Chelsea London Dry Gin. Chelsea London Dry Gin now comes in a non-refillable bottle with guava cap. Chelsea London Dry Gin. Right spirit, right feeling.
Spectrum TV, broadening your horizon.